Doc Talk with Dr. Paul Conley is a production of TTV, which is solely responsible for the content.
Hello, I'm Dr. Paul Conley. Thanks for tuning in to another episode of Doc Talk. This evening I got Dr. Anita Stewart. We are here at the health department, and Dr. Stewart and I have been talking about some of the things that have changed throughout our medical career, and that is tick-borne illnesses. And so tick bite and ticks in general. And so Dr. Stewart is going to talk to us tonight about not only tick-borne illnesses, but she's going to talk to us about the different ticks that are out there and how we can prevent these tick-borne illnesses. So Dr. Stewart, thank you again for coming onto the show.
Yeah, thank you for inviting me to talk about such an important topic.
So, we were talking actually before we're getting mic'd up and everything here at the health department, and we were talking about, when we were in residency back in the day, that here in the state of West Virginia, Lyme disease really wasn't something that we really thought that much about. Lyme itself is named after a town, Lyme, Connecticut, and it is a bacteria that is in the Borrelia family, Borrelia burgdorferi, and it's transmitted from this tick, the black-legged tick or the deer tick. But, it was really something that, we talked about, 25 years ago, that it was something that we would see Lyme's, but it was someone that was outside the state. They went up to New England State and, they brought it back, but we really didn't see it here. But now not only is Lyme disease endemic to West Virginia, but we're also seeing other tick-borne illnesses as well, such as Ehrlichia, rickettsia, Rocky Mountain spotted fever. We're also seeing things such as alpha-gal. These are all, again, tick-borne illnesses. And before the show, you'd even mentioned anaplasmosis and babesiosis. And so tonight what I'd like to do is first of all, I'd like for you to talk to us a little bit about Lyme disease and ticks and basically what the type of tick we're talking about. And then after the commercial break, we're going to talk about not only prevention, but I'd like for you to talk a little bit about treatment and what are some of the symptoms of some of these tick-borne illnesses. So,
Sure.
So maybe you can talk to us a little bit about, when we talk about Lyme disease and tick-borne illnesses, maybe you can talk to us a little bit about the tick itself. And, I think we were talking about earlier, that these ticks aren't born with, these diseases. So maybe you can talk just briefly about the life cycle of the tick so we can get a little better understanding of how this works.
Yeah, and I think what we you touched on this a little bit. In the past, probably 15, 20 years, we really didn't have Borrelia here, or even the black-legged tick that transmit these diseases. We know that the white-tailed deer is the host for those. We have lots of those here in West Virginia, and with changes to our climate, we've noticed that it's been more hospitable, easier for those ticks to survive, specifically like our winter months. And so we're seeing more of those diseases here. In fact, in the past probably 3 to 4 years in public health, we've seen approximately 200% increase in Lyme's disease. Lyme's is a reportable disease to our local public health departments, and it's certainly something that we're seeing increased burden both in public health but also within our healthcare and hospital systems. And so the reason I mention all of these things is that I think if you're outdoors, you need to consider yourself at risk for ticks. So if you're outside, just know that a tick, potentially any type of tick, you could be exposed to that. So making sure that you're taking precautions and checking, and we'll talk a little bit more about how to be effective with that. The tricky thing with ticks, especially as they're in their early life cycle or in their nymph phase, that's like the baby tick. They're tiny. They're like the head of like your ink pen that you have there. Very, very small. They kind of look like a freckle. They're really hard to see. If you really weren't being intentional about looking for them, you would miss it. And so really just thinking about, like, if I'm outside, that's a potential. I need to be paying attention to those things. And then as the nymph takes what we call a blood meal or eats from another host, whether that be like a bird or a squirrel or some other small rodent, then that causes it to grow. It can also cause it to then house that bacteria. And then when it bites another host, be it a deer or a person, it can then transmit that. Now, we really don't see much transmission that kind of impact the deer per se, but we do see it within like humans, as well as within like our other pets like dogs and horses and things like that. So so certainly, being mindful that the ticks look different at different stages, but to really kind of keep an eye on kind of the tiny little deer tick, and then as they get larger, the black, as it grows, looking more like a traditional black-legged tick.
One thing that you brought up, and I think you're talking about the climate, and I think we all have to admit that the climate has changed and is continuing to change. And so, I used to think that, we think about ticks, and it seemed like it was always 40 degrees and warmer. Mm-hmm. So, April through October, which is, when we're out and about, and that's when ticks are out and about. But, I literally have, because I'm a hunter, and I think a lot of people know that, I literally have been out in the woods, in November and even December. And so I think, now we're starting to see that, ticks are, that's almost become a year-round type of phenomenon, and so if you're out in the brush, in the weeds, you just need to be aware that there is a potential that you could come in contact with a tick.
Yeah, absolutely. And we certainly want people to be doing those things. I mean, I do public health and I'm a physician, and we want people to be active and be outdoors and enjoy nature. It's so good for our health. But, we just need to be thoughtful about those things and know what our risks are and make sure that we're trying to prevent those things and check when we get back inside.
So when we think about, you kind of mentioned that there are, the different ticks, and you're right that these black-legged ticks, they not to be confused with the dog tick, which is much bigger. And I think so. You really have to do a really good job of inspecting yourself, because even these ticks, even when they are engorged, are still very small, like a poppy seed. So maybe I want you to talk to us a little bit about the tick itself, because again, after the commercial break, we're going to talk about prevention, removing tick, mm-hmm. and how to prevent that. But so when we think about the tick itself, there is a time period that the tick has to be on you to transmit. So maybe you can talk to us a little bit about, you have a tick, it's a small little poppy seed. Not all, number one, all ticks are infected, but number two, there has to be some transmission time for that to occur.
Yeah, that's a great point. So I think it's important that if the tick is not attached and is crawling on you, the chance of transmission is 0. And so the tick has to have what we call a blood meal. And I know that might sound a little gross, but it has to attach, it has to, to feed, to get blood to be able to transmit Lyme's disease. That typically takes 24 to 36 hours. The tick will look fuller, and you can, we all have social media and internet, or look through the internet. You can look at what that looks like on there. The tick kind of looks thicker, fuller, more plump, and certainly that would be what we would call like an engorged tick, or a tick that had a blood meal. And if you see that, then it does increase the chances of transmission. Now, not every tick is infected. Even the black-legged ticks, they don't all carry Lyme's disease or these other tick-borne illnesses, but the chances of having that transmission are increased by having a known blood meal.
So I think that's one of the things that's super important, is that you understand that, do these tick checks, because just to your point, if you know that tick has not been on you for over 24 hours, and you're pretty daggone sure it's not, then your chances of that tick transmitting any of these infections that we've talked about really goes down to almost negligible. So just because you have a tick on you doesn't necessarily mean that you are for sure going to develop a tick-borne illness. Yeah,
absolutely. And I think also, like, again, if you have a tick and even if it's attached, if it's not engorged, it's not going to transmit. So the risk of that is very, very low. Nothing to be worried about.
So speaking of that, maybe you can walk us through a little bit about, before we go to the break, about these tick checks. What do we do? You're going to go on a trail, you're going on a hike. Tell me a little bit about that. And also, when you go out on a hike, maybe you can talk about where do ticks live, okay? So, they're not necessarily living on the hike, if you're walking like, on asphalt and down the sidewalk, but, ticks, I mean, they're not insects, so they don't fly, they don't jump, they're crawlers. And so tell us maybe a little bit about, you're going to go out, not only the tick checks, but where are the ticks hanging out? Where do we need to avoid? What do we need to try to do to avoid, running into the same place that they live?
Yeah, ticks like brush. They have to have a habitat that they can hide and live and thrive in, and that's usually in the brush. And so, if you're staying on a trail and it's not, there's no weeds or any brush kind of along the sides, it's typically pretty safe. Also thinking about making sure that you're wearing either long pants or doing making sure you're wearing clothing that you can easily see the ticks on. I think that's helpful. So thinking about like lighter clothing because the black ticks do stand out a little bit easier on those. And then thinking about when you are checking, common places that ticks like to go are places with creases. So thinking of, and hair, frankly, because it's easier for them to hold on. So think places like the axilla or the armpit, in the groin area, around the ankles, in the hairline specifically, are places that are just more prone to having ticks go to. They like those areas. And so making sure that you're checking those areas certainly afterwards.
So I think it's important, so when you come in from your hike that, I know when I'm outside doing anything, especially with this heat, you're going to be hot and sweaty. So you're going to get in the shower. Yeah. So make sure you really inspect yourself. But I think, again, we talked even before the show, we really want to try to focus on prevention. I think a lot of it just being aware. Yeah. So, even around your own home. Mm-hmm. So you're talking about grass, okay? So, if you're letting your grass get kind of tall, the ticks like to sit on the top of that. So when you brush by, the tick can, just kind of climb onto you. So, make sure you're mowing your grass. Make sure that if you got a pile of wood over there, that there's ticks going to live in that. They like kind of damp areas because we do know that ticks, like wooded areas and they like brushy areas. And we do know that Lyme disease has been basically identified in all 50 states. There's been some question about maybe Hawaii, but from any other state, we know that ticks are there. So anytime there's brush and anytime there's grass, and if you're like wading through tall grass and it's up to your knees, I mean, a tick is going to have a very good chance to attach to that, and then they're going to crawl up you. So if you have light colored pants or light colored clothing, you could see that little black-legged tick, crawling on you. So I think that's also important, just that you kind of are aware that's even around your own home.
Yeah, and I think it's important to mention too, like if you do have a yard in your house, really thinking about creating a distinct brush line, and then if you're going to have areas like where kids play, so like playground equipment or slides or swings or a place that like you hang out in your yard, making sure that it's like within 8 feet away of that brush line. So that's going to really keep you safe in your own yard. Again, we want people to be outside. We want them to be enjoying the outdoors, but just these simple strategies can help reduce risk and keep you safe from things that we know are pretty prolific in our community.
Yeah, and of course, like a lot of us, we have pets, and we're going to talk a little bit about too. Our dogs also. So if your dog's out to run through high weeds and high grass out in your yard because you haven't tended your yard, sometimes I am bad about that. They too can bring in a tick, and so they actually can bring the tick into you, and so that also can be a way to transmit. So we're up on a commercial break. When we come back, as you can see, we actually have some sprayers here. We got a little sprayer, little hand sprayer. We got some tweezers, and Dr. Stewart's going to talk to us a little bit about when we do go out and about, how we can prevent or protect ourselves from being bit by that tick. So we're going to take a commercial break, and I'm Dr. Paul Conley of Doc Talk, and we'll be back here in just a couple minutes.
You're watching Doc Talk with Dr. Paul Conley on WZTS 16 Cozy TV. Stay with us. We'll be right back after these messages.
Vandalia Health is proud to be a West Virginia-owned healthcare system, bringing together the hospitals and providers of CAMC, Mon, and Davis. We are dedicated to enhancing the health of our communities through clinical excellence. Our compassion and commitment remain the same with people you know and trust to care for you and your families. With more specialists, hospitals, and outpatient locations, we're delivering expertise and state-of-the-art care. Vandalia Health, expert care close to home.
Welcome back. Doc Talk with Dr. Paul Conley continues on WZTS 16 Cozy TV.
Hello, I'm Dr. Paul Conley, host of Doc Talk, and we are here with Dr. Anita Stewart, and we've been talking about tick bite, we've been talking about tick-borne illnesses, focusing more on Lyme disease, and one of the things I think, maybe I failed to mention that, one, it's in, West Virginia, which is where we are. It's actually noted to be within the whole country. There are some hot spots, but definitely West Virginia being one of those. And it's 500,000 Americans, roughly, I think, each year. Am I right with that? About 500,000 are infected with Lyme disease annually. And so I'm going to have Dr. Stewart talk to us a little bit about the diagnosis of Lyme disease. And then before we wrap up, we're going to talk about how to remove the tick and how we can actually prevent tick bites. So we talked about before the break about how the tick has to be engorged. Typically has to be 24 hours. So, hey, I got a tick. It's on me. And I'm having some symptoms. So maybe you can describe symptoms. Like what would a person with Lyme disease, how would they present? And maybe you can talk a little bit about the clinical presentation, and maybe you can talk about the value or maybe not so valuable laboratory testing is.
Yeah. I think those are all great things to bring up. One of the things I want to mention is that half of the cases that we see don't report a tick bite. So patients are just coming in, they're having fevers, chills, body aches, sometimes joint pain, headache, some just not feeling well typically, and sometimes they'll have a rash. If you're lucky, about 70% of them will have a rash. It looks, the hallmark of that rash is that it looks like a bullseye. If you see those things, then that's pretty slam dunk Lyme's disease here. What we know is, again, they may report a tick bite, they may not. So I think it's really important that if you're having these symptoms, even if you haven't had a tick bite, to make sure you talk to your healthcare provider about this. Now, you mentioned a little bit about testing and timing. And so what we typically see is that people are going to have those symptoms 7 to 10 days, a lot of times after, sometimes even sooner than that, after a tick bite. Or even, again, you might not have a tick bite. What makes it tricky is that we have to really rely on the clinical picture, because the lab testing for Lyme's disease frankly just isn't that strong. If it's negative, it doesn't really tell us a lot. So it means it's just not as reliable. The other thing is, again, Lyme's disease is very endemic here. We see lots of it. So if you've ever had Lyme's disease in the past, your lab testing is not reliable because that can still look positive. So it doesn't really help in that picture. So we do have a window of like 10 to 14 days. We have to wait for really that lab test to be more reliable. And again, I will say even then, it's not that reliable. So we're really looking at what the clinical picture is, what the timing of the disease is, and how folks are feeling to really determine, do we think this Lyme's disease is Lyme's disease? Should we initiate treatment? What we know is that early treatment is better. We don't want to wait around. We don't want people to suffer. We don't want people to get complications related to Lyme's disease, which can certainly lead to like neurological issues, heart blocks, joint swelling, Bell's palsy, things like that. So we want to initiate treatment pretty quickly with antibiotics.
So when we think about antibiotics, we think about doxycycline. Now, if you have a child, we wouldn't use doxycycline. So in this situation, amoxicillin, is that still preferred for children? We actually, if it's less than 14 days, the American Academy of Pediatrics does say that we can use doxycycline pretty safely in that population, because we know it is superior for Lyme's disease, but certainly amoxicillin works well. Looking at folks' drug allergies, are they able to take those things? Sometimes we have to use a third generation cephalosporin in some of those instances. But certainly, talk to your healthcare provider. They can find out what would be best for you in the course and certainly get you treated to get you feeling better. So I think, the caveat is that, again, it's a clinical diagnosis, and so the erythema chronicum migrans rash, that's the bullseye rash. But again, not everyone, you heard Dr. Stewart say, she didn't say 100%, so not everyone comes in with that bullseye rash, and so it's a clinical situation. And again, we talk about the laboratory studies, they're all over the place. If you go to some of these labs, everyone comes back positive. So I would definitely rely upon a healthcare institution or an academic center when we do these labs. But just to your point, if you have early Lyme's, it may take weeks before the lab test would even be positive. So a negative test doesn't really help so much in that clinical scenario. You would recommend you would still go ahead and treat.
Absolutely. And specifically, if it fits the clinical picture, knowing that we are an endemic area for Lyme's disease, I would absolutely initiate treatment.
So I do think, we talked a little bit even before we went on the show, and again, this is where you really need to talk to your healthcare provider. There is some thought about prophylaxis, and so maybe you can just briefly just talk about who would be. Now again, remember, if the tick's crawling on you, not embedded, that's not a prophylaxis patient. You checked yourself thoroughly, you go on a hike, a few hours later you get a shower, there's a tick, that's not prophylaxis. So who would you consider prophylaxis, and what is the prophylaxis for Lyme's disease?
Yeah, I think that's a great point. So what the recommendations are that if you are in an endemic area of Lyme disease, similar to this broadcast area or the Northeast, those types of things, you had a tick that was attached and engorged for more than 36 hours. So, an example would be, Paul, if you were out in your farm on Saturday and today's Monday, and you're like, fine today, like, oh my gosh, there's a tick attached to me and it's engorged, I'm going to remove that, and then what do I do next? So the answer to that is that you would call your healthcare provider, let them know what symptoms you were having, what had happened, and we would typically recommend a one-time dose of doxycycline, 200 milligrams orally, to take to reduce the risk of transmission of Lyme's disease. And so we are looking at this type of public health strategy to reduce the overall burden of Lyme's disease, and certainly it's something that local healthcare providers are offering here.
So I think, again, the caveat, not to beat this to death, but, crawling on you, that's not that patient. A couple hours, not that patient. Dog tick, not that patient.
Correct.
So remember, we're talking about Lyme's disease and prophylaxis for Lyme's disease, not some of these other tick-borne illnesses. It's got to be the right tick, folks. And so again, that's the deer tick, that's that black-legged tick. The common dog tick, that does not harbor Lyme's disease. So now what I really want, again, the prevention. So the prevention part, and so, some of you folks may recall years ago that there was a vaccine for Lyme disease for humans, and it just didn't really pan out, has some adverse issues, and just not that effective. So there is a vaccine actually for our pets, for our dogs, and so I'm going to have Dr. Stewart, just, not that we're either one of us are veterinarians, but there is something we can do to take care of our pets, because dogs, can actually develop Lyme disease. But if you look over here, I brought a couple of things in myself, and so Dr. Stewart talked about being on the farm. I like doing things outdoors, and I'm out in the weeds and running through brush. And so one of the things that I want you to talk about is, there is a little bit of a difference between how we prevent and protect from mosquitoes versus ticks. So maybe you can talk about this that I have right here in my hand that you can pick up at one of your tractor supplies, one of your farm and fleet type of stores.
Yeah, and I think there's different ways to treat, and I think being thoughtful about what works best for you and frankly what you're going to use. And I know some people prefer just to treat their clothes, so they would use something like this. They would put it in a spray bottle, they would spray their clothes, and then they would put their clothes on. That would be their outdoor wear that they would wear to reduce ticks. Other things that you can use for ticks are like eucalyptus is fairly effective, and lemongrass are fairly effective, but certainly permethrin is the gold standard to prevent tick-borne diseases and to reduce that burden. So certainly putting that either directly on your skin or your clothes. I prefer clothes just because it's easier. And then making sure, especially like if you have a hat that you're wearing, that you're also putting it on your hats and around like the ankle area specifically. If there's areas outdoors you're going to be, there are ways to spray, but typically just making sure that you've treated either your clothes or your skin.
So I have a couple pairs of old jeans that are my work clothes, and so you mix this. It actually has this little applicator here, and you actually dilute this in a sprayer, and then I will spray it on my work boots and then my lower pants legs. And we do know that this is effective for multiple washings, up to 6 washings. And so these are my work jeans. These are the jeans I wear. I know that for basically 6 washings, and I take this and I spray up and down my legs if I'm going hunting, turkey hunting, what have you, and I spray this. And so this actually, because again, ticks are crawlers, they like to crawl up you. They don't fly, they don't jump, they crawl on you. So if you're wading through grass, okay, and it's, basically calf high, if I have this on, they're not going to want to get on my clothes with this on there. So one of the things too that I wanted to talk just a little bit about is prevention, wearing long pants. I know we talked earlier about, if you can tuck your pants into your socks, again, because ticks want to crawl up you. And so if they can't really get on your skin because your pants are tucked in your socks, and then you've also sprayed permethrin, then the likelihood is that they're going to not want to attach to you. But let's just say, again, we have a tick attached, and some people are kind of squeamish about that, and that's one thing I wanted you to do, because I grew up in a time, Dr. Stewart, when matches were pretty common, lighters. In fact, I'm so old, before the show we even talked about cigarette lighters in your car. I'm sure people watching the show don't even know what that is anymore, but cigarette lighters. There is a proper way to remove the tick, and there's an improper way to remove the tick. So I wanted you just to show the audience about, you have a tick, it is on you, and if you are super squeamish, you can go to the MedExpress, and healthcare providers can do this for you, but this is something you can actually do at home. So maybe you can talk a little bit about how is the proper way to remove a tick.
Yeah, so we're going to pretend on you, because I like to, use
Pinch
you as a patient.
skin.
Yeah. And so remember, it's going to be little, like a freckle. You can kind of see Paul's got a little, or Dr. Conley's got a little freckle right here. You would want to make sure you're at a 90-degree angle with your tweezers. These are just plain tweezers. Any type of tweezers work. So anything, whatever you pluck your eyebrows or your chin hairs, whatever you have at your house, get your tweezers out. You're going to go at a 90-degree angle, and you're going to just gently squeeze at the base where they're attached. So right near kind of the head of the tick. And by gently squeezing and then slowly pulling up, typically the tick will release its little mouth parts, and you can gradually pull the tick out without that being embedded in there. Now, sometimes they do keep kind of their little fangs embedded, and you would just wash that really well with soap and water if that happens. You don't need to go to, dig those out. You don't need to do anything. Your body will kind of work that out itself. But typically, if you just gently squeeze, 90-degree angle, and then gently pull up, that will remove the tick without much fuss. And do the trick. Now, I will also say, certainly it's hard to see those little ticks, so you can use either your smartphone or a magnifying glass or something like that to really look closer at the tick to see, is it engorged? Is this a black-legged tick, or is it a deer tick? What am I really dealing with here? Is this something I need to be worried about or not worried about? And that's all, those are all really important things to be able to know, so then you can share that with your healthcare provider about, what do I do next?
And I think it's important that if there is a question, once you've slow traction, pulled it away, don't jerk it, because you can actually, get those mouth parts, and you don't want to crush it because it can inject the bacteria into you. But if there is a question, you can actually pull it off of you, and you can actually bring it into your healthcare provider, and then they can identify the tick for you. So anyway, we're running out of time as always. We always come to the end of the show, Dr. Stewart. I can talk to you for hours and hours, but I really appreciate you coming on the show. We've been talking about tick bite and tick-borne illnesses. Again, be aware. Prevention is so much better than treatment. So when you're out in the woods, be careful with the brush, watch the weeds, do your tick checks, and enjoy what West Virginia has to offer and just try to prevent from being bitten by a tick.
Yeah, wild and wonderful for a reason.
Well, thanks for tuning in. I'm Dr. Paul Conley. We've been talking about tick-borne illnesses. Until next time, have a good night.